When we talk about managing high blood pressure in older adults, one of the most commonly prescribed medications you will hear about is amlodipine. Now, before anyone simply accepts a prescription and starts taking it without understanding what is happening inside the body, it is important to slow down and truly grasp what this medication is designed to do and why it is used so widely. Amlodipine belongs to a group of medicines known as calcium channel blockers. In simple terms, what this means is that it works on the smooth muscles of your blood vessels. As we age, our blood vessels naturally become stiffer, narrower, and less flexible. This is part of the aging process, but when combined with conditions like hypertension, it puts extra pressure on the heart. The heart then has to work harder, almost like a pump pushing against a tightened hose. Over time, this strain can lead to complications such as heart enlargement, stroke risk, kidney damage, and general fatigue of the cardiovascular system. What amlodipine does is help to relax those tightened blood vessels. It allows them to open up more, improving the flow of blood and reducing the resistance the heart has to pump against. When the resistance drops, the blood pressure also comes down, and the heart is able to function in a more relaxed, efficient way. For many seniors, this can mean better protection from life-threatening complications and improved overall stability in daily health. But understanding the mechanism alone is not enough. The real conversation begins when we talk about how the aging body responds differently to medication. In younger individuals, the body tends to adjust and compensate quickly. In older adults, however, metabolism slows down, kidney function may not be as strong as before, and sensitivity to medications increases. This means that even a standard dose that works well for one person might feel too strong for another. This is why I always emphasize that amlodipine is not just a take it and forget it kind of medication. It requires awareness. When blood vessels relax too much, or when blood pressure drops more than expected, a senior may begin to feel lightheaded, especially when standing up from a sitting or lying position. This is something many people ignore, thinking it is just normal aging, but it is actually a very important signal from the body. It is the body saying that the pressure may be going lower than what is safe for your current condition. Another important point to understand is that blood pressure is not just a number. It is a reflection of how well blood is being delivered to vital organs such as the brain, kidneys, and heart. If blood pressure is reduced in a controlled and balanced way, these organs are protected. But if it drops too quickly or too low, the same organs may begin to experience reduced perfusion, meaning they are not receiving enough blood flow. That is when problems like confusion, weakness, or even falls can begin to appear in elderly patients. Now, amlodipine is often preferred because it has a long duration of action. This means it stays in the system for many hours, providing steady control rather than sudden spikes and drops. That stability is one of its biggest advantages. However, it also means that if a side effect occurs, it may take time for the body to adjust. Unlike short-acting medications that come and go quickly, this one maintains its presence, which is why careful dose selection is extremely important. It is also worth noting that not every patient experiences the same effects. Some may take it for years with no issues at all, while others may notice swelling in the ankles or mild fatigue within days or weeks. This swelling happens because blood vessels are more relaxed, which can sometimes cause fluid to accumulate in the lower parts of the body due to gravity. It is not always dangerous, but it should never be ignored or dismissed without evaluation. One of the biggest mistakes I see in clinical practice is patients assuming that once a blood pressure medicine is prescribed, it does not need to be reviewed again. That is not true. The body changes over time, and so does its response to medication. What worked one year may need adjustment the next. That is why regular follow-ups are not optional, they are essential. Equally important is how amlodipine fits into the larger picture of a patient's lifestyle. Medication alone does not control blood pressure. Diet, salt intake, physical activity, stress levels, and sleep quality all play a major role. Amlodipine supports the system, but it does not replace healthy habits. When patients understand this, they begin to see medication not as a standalone solution, but as part of a coordinated effort to protect the heart and vessels. There is also a psychological aspect that should not be overlooked. Many seniors feel anxious when starting a long-term medication. They worry about dependency or lifelong use. It is important to understand that hypertension is often a chronic condition, and managing it is about prevention, not cure. Amlodipine is not a burden. It is a protective tool when used correctly and monitored properly. So when we step back and look at the bigger picture, amlodipine is a valuable medication that plays a significant role in protecting cardiovascular health in older adults. But its effectiveness depends on understanding, respect for its power, and regular medical supervision. It is not about fear, and it is not about blind trust either. It is about informed balance. Because at the end of the day, the true goal is not simply lowering numbers on a machine, but ensuring that every heartbeat continues with strength, every step is steady, and every day is lived with safety and confidence in the body's rhythm. Now, let us talk about something that is just as important as the medication itself: the side effects that many seniors experience but often overlook or underestimate. This is where understanding becomes not just helpful but protective. Because in medicine, what you ignore can sometimes become what harms you. When a person begins taking amlodipine, the expectation is usually simple: lower blood pressure, protect the heart, and improve overall circulation. And yes, that is exactly what the medication is designed to do. But the human body is not a machine that responds in a single, predictable way. Especially in older adults, every system in the body is already adapting to age, to long-term health changes, and sometimes to multiple medications taken together. So when a new drug is introduced, the body speaks. The question is whether we are listening. One of the most common effects that seniors may notice is swelling in the ankles or feet. Now, many people see this and immediately dismiss it. They say, "It's just because I am getting older," or "I stood too long today." But medically, this swelling, what we call peripheral edema, is a known response to amlodipine in some individuals. It happens because the blood vessels, especially in the lower limbs, become more relaxed, and fluid can slowly accumulate in the tissues due to gravity. It is not always dangerous, but it is never something to ignore without assessment. Because sometimes what starts as a mild swelling can affect comfort, mobility, and in certain cases, indicate that the dosage or combination of medications needs review. Then we have dizziness, another very important symptom that deserves attention. Many seniors feel a slight spinning sensation or lightheadedness, especially when they stand up quickly. This is often linked to what we call postural or orthostatic changes in blood pressure. When the blood vessels are relaxed by amlodipine, the body may take a moment to adjust blood flow when changing position. In younger people, this adjustment is fast and almost unnoticeable, but in older adults that response can be slower. So when a person stands up too quickly and feels unsteady, it is not just a random feeling. It is the cardiovascular system adjusting under medication influence. And here is where the danger lies. Dizziness in seniors is not just an inconvenience. It is a risk factor for falls. And falls in elderly individuals can lead to fractures, hospital admissions, and long recovery periods that significantly affect independence. So when we talk about dizziness from blood pressure medication, we are not talking about a minor side note. We are talking about safety, balance, and quality of life. Another symptom that is often reported is fatigue or unusual tiredness. Some patients describe it as feeling heavier, slower, or less energetic than usual. This can be confusing because amlodipine is not a sedative medication. It does not directly make you sleepy. But when blood pressure is lowered, the body may take time to adjust to a new level of circulation. In some cases, if blood pressure drops more than the body is accustomed to, the muscles and brain may feel like they are operating at a slightly reduced level of energy. It is subtle, but it is real. And for a senior who is used to being active, even a small reduction in energy can feel very noticeable. Now, I want to be very clear about something important. Experiencing side effects does not automatically mean the medication is wrong for you. That is a common misunderstanding. Many times, these effects can be managed simply by adjusting the dose, changing the time of administration, or reviewing other medications that might be interacting in the background. This is why communication with a healthcare provider is not optional. It is essential. There is also something deeper we must address, and that is the tendency for many seniors to normalize discomfort. There is a mindset that says, "I am old, so this is expected," or "I should not complain." But in medical practice, we do not measure health by silence. We measure it by function, comfort, and stability. If your body is sending signals, swelling, dizziness, fatigue, those signals are meaningful. They are not complaints. They are information. Another important aspect is how side effects can appear gradually rather than suddenly. Amlodipine is a long-acting medication, so changes in the body may develop slowly over days or weeks. This can make it harder to recognize the connection between the medication and the symptom. A person may think, "I just feel a bit off lately," without realizing that the timing aligns with starting or increasing a dose. This is why monitoring and awareness are so critical, especially in the first few weeks of treatment or after any dosage adjustment. It is also worth noting that not every patient experiences side effects in the same way. Some may take amlodipine for years without any noticeable issues. Others may need careful adjustment or even a switch to a different class of medication. There is no universal response in medicine, especially in elderly care. Each individual is a unique balance of physiology, lifestyle, and medical history. What truly matters is not fear of side effects, but understanding them. Because when you understand what your body is telling you, you gain control. You become an active participant in your own health, not just a passive receiver of treatment. And that shift in mindset is one of the most powerful tools in managing chronic conditions like hypertension. So when we speak about amlodipine and its side effects in seniors, we are not speaking to discourage its use. We are speaking to encourage awareness, because the goal is never just to lower numbers on a chart. The goal is to maintain strength in movement, clarity in thought, and safety in daily living. And that is why every symptom matters, every change matters, and every signal from the body deserves attention before it becomes a bigger concern. Now, there is a very important truth I want every senior listening to understand clearly, and it is something that is often overlooked even in medical conversations. When we treat high blood pressure, our goal is not simply to bring the numbers down at all costs. The real goal is balance. Because blood pressure is not meant to be forced too low. It is meant to be controlled within a safe, stable range that allows every organ in the body to function properly. Many people assume that if high blood pressure is dangerous, then the lower it goes, the better. But in medicine, especially in elderly care, that is not always true. The body needs a certain level of pressure to push blood to the brain, the kidneys, and the heart. If that pressure becomes too low, those vital organs may not receive enough blood flow. And when that happens, the effects can be just as serious as high blood pressure itself. This is where amlodipine requires careful attention. Because while it is effective in lowering blood pressure, its effect is steady and long-lasting. That is a strength, but it also means that if the dose is slightly higher than what the body currently needs, the reduction in blood pressure can become too much, especially in older adults whose systems are already more sensitive and less adaptable. Now, one of the first things that can happen when blood pressure drops too low is dizziness. But this is not the usual mild dizziness we sometimes associate with fatigue or dehydration. This is the kind that appears when a person stands up and feels like the ground shifts slightly beneath them. It is caused by a temporary reduction in blood flow to the brain. In younger individuals, the body corrects this almost instantly. But in seniors, that correction may take longer, and in that brief delay, instability can occur. And this is where the real danger begins, because dizziness leads to something far more serious: falls. A simple fall in an older adult is not a small event. It can lead to fractures, hospital stays, loss of independence, and long recovery periods that affect both physical and emotional health. So when we talk about blood pressure being too low, we are not just talking about a number on a machine. We are talking about safety while walking, confidence while standing, and stability in everyday life. Another effect that may appear when blood pressure drops too far is confusion or mental fog. The brain is extremely sensitive to changes in blood flow. When it does not receive enough oxygen, rich blood, even for short periods, a person may feel disoriented, forgetful, or slower in thinking. Family members sometimes notice this before the patient does. They may say, "You seem a bit different today," or "You are not as sharp as usual." And while many causes can contribute to this, one of them can be overly lowered blood pressure. This is particularly important because cognitive changes in seniors are often wrongly attributed to aging alone. But sometimes the cause is reversible. It may be related to medication levels that are slightly too strong for the current condition of the body. That is why regular monitoring is not just about checking numbers. It is about protecting mental clarity and daily functioning. We must also consider kidney function. The kidneys are very dependent on adequate blood pressure to filter waste from the blood. When pressure drops too low, the filtering process can slow down. In some cases, this can lead to changes in kidney performance over time, especially in individuals who already have underlying kidney conditions or other chronic illnesses like diabetes. This does not happen suddenly in most cases, but it is something that builds quietly if blood pressure is consistently too low for the individual's needs. Now, I want to emphasize something very important here. The danger is not in using amlodipine. The danger is in assuming that one fixed dose is perfect forever. The human body changes. A senior who needed a certain dose 5 years ago may not need the same dose today. Weight changes, diet changes, kidney function changes, and even seasonal variations can influence how the body responds to medication. This is why blood pressure management is not a one-time decision. It is a continuous process of observation, adjustment, and communication. When patients feel unwell, whether it is dizziness, weakness, or unusual fatigue, it should never be ignored or accepted as normal without evaluation. Sometimes the solution is as simple as adjusting the dose slightly, or changing the timing of the medication. Another key point is hydration. When blood pressure is lowered, the body becomes more sensitive to fluid levels. If a senior becomes dehydrated, even mildly, the combined effect with blood pressure medication can make symptoms of low pressure worse. This is why maintaining adequate fluid intake, unless restricted by a doctor, is part of safe blood pressure management. There is also a psychological aspect that we must not ignore. Some seniors, when they see lower blood pressure readings, feel reassured and assume everything is perfect, even if they are experiencing symptoms like dizziness or weakness. But the number on the machine is only part of the picture. The real measure of safety is how the person feels and functions in daily life. So when I speak about blood pressure being too low, I am not trying to create fear around treatment. I am trying to create awareness around balance, because medicine is not about pushing the body in one direction too aggressively. It is about guiding it gently into a range where it can function at its best. The heart, the brain, the kidneys, all of these organs depend on harmony. Not too high, not too low, but just right for the individual. And that just right is different for every person, especially in older age. So the message is simple, but powerful. Lowering blood pressure is important, but maintaining safe circulation is essential. And when those two goals are balanced correctly, that is when treatment truly becomes protection. Now, as we bring everything together, there is a final and very important principle that often determines whether blood pressure treatment succeeds or fails in real life. And it is something many people underestimate until problems begin to appear. Medication alone is never the full answer. Amlodipine, or any blood pressure medicine for that matter, is not designed to work in isolation while everything else remains unchecked. It is part of a larger system, a partnership between the medicine, the body, and the daily habits of the person taking it. And when that partnership is ignored, even the best medication cannot deliver its full benefit. For seniors especially, the first responsibility is monitoring. I cannot emphasize this enough. Blood pressure is not something to be checked only when you feel unwell. In fact, waiting until symptoms appear is often too late, because blood pressure changes can be silent for long periods. Regular monitoring at home or during clinic visits allows us to see patterns, not just isolated readings. It tells us whether the medication is working steadily, whether the dose is appropriate, or whether adjustments are needed before complications arise. Many patients tell me, "Doctor, I feel fine, so I stop checking." But feeling fine does not always mean everything is stable internally. Hypertension is often called a silent condition for a reason. It can quietly affect the heart, the kidneys, and the blood vessels without causing immediate symptoms. That is why consistency in monitoring is not optional. It is protective. It gives us the ability to catch small changes before they become big problems. Now, along with monitoring comes communication, and this is where many treatment plans either succeed beautifully or begin to fail quietly. Seniors should never hesitate to report changes in how they feel, even if those changes seem minor. A little swelling, a bit of dizziness, a slight change in energy level. These are not complaints to be ignored or dismissed. They are valuable pieces of information. In fact, sometimes the smallest symptom is the earliest warning sign that a medication adjustment is needed. What often happens is that patients adapt to discomfort over time. They begin to normalize it. They say things like, "It's not too bad," or "I can manage it." But in medicine, we do not aim for manageable discomfort. We aim for optimal function, comfort, and safety. If a medication is causing persistent side effects, even if they seem mild, it deserves attention. Because over time, those mild effects can influence mobility, confidence, and overall quality of life. Another crucial part of safe use is understanding medication interactions. Many seniors are not only on amlodipine, but also on other medications for diabetes, cholesterol, pain, or other chronic conditions. When multiple medications are taken together, the way each one behaves in the body can change. Some may enhance the effect of amlodipine, lowering blood pressure more than expected. Others may affect kidney function or fluid balance, indirectly influencing how the body responds. This is why it is so important that every medication a patient takes is known and reviewed together by a healthcare provider. Self-adjusting medications or taking additional tablets without guidance can quietly disrupt this balance. Even over-the-counter drugs or herbal supplements can sometimes interfere in ways that are not immediately obvious. Lifestyle, too, plays a powerful role that cannot be ignored. Medication supports the body, but lifestyle determines the environment in which that medication works. Diet, for example, has a direct impact on blood pressure control. High salt intake can counteract the effect of amlodipine, making it less effective. On the other hand, a balanced diet rich in fruits, vegetables, and proper hydration supports stable blood pressure levels. Physical activity is another key factor. For seniors, this does not mean intense exercise. It means regular, gentle movement, walking, stretching, or light household activity. These help maintain circulation, support heart health, and reduce stiffness in the body. A sedentary lifestyle, especially when combined with blood pressure medication, can sometimes lead to weakness or reduced endurance over time. Sleep and stress management are equally important. Poor sleep can elevate blood pressure, while chronic stress keeps the cardiovascular system in a constant state of tension. Even when medication is taken correctly, uncontrolled stress can reduce its effectiveness. This is why emotional well-being is not separate from physical health. They are deeply connected. Now, there is also an important mindset shift that every senior on long-term medication must adopt. Blood pressure management is not about short-term correction. It is about long-term stability. There will be days when readings are perfect and days when they are not. There will be times when the body feels strong and times when it feels sensitive. The goal is not perfection every single day, but consistency over time. And this is where trust in the process becomes important. Trust in monitoring, trust in communication, and trust in regular medical review. When all these elements come together, amlodipine becomes more than just a tablet. It becomes part of a coordinated system that protects the heart, preserves strength, and supports independence. So I always remind seniors, do not see yourself as passive in this process. You are not just someone taking medication. You are an active participant in your own health journey. Every reading you take, every symptom you notice, every conversation you have with your healthcare provider adds strength to your treatment plan. Because in the end, the success of blood pressure control is not measured only in numbers on a screen. It is measured in how steadily you walk, how clearly you think, how safely you move through your day, and how confidently you live your life without fear of sudden health disruptions. And that is why communication, monitoring, lifestyle, and awareness are not separate ideas. They are the foundation upon which safe and effective treatment truly stands.